Good evening, Eleni Roussos with ABC News. The Northern Territory's Aboriginal organisations are looking for more clarity about how to prepare their communities if a coronavirus outbreak was to strike. It comes as the number of coronavirus cases continues to rise in Australia, with 93 confirmed cases, including one in the Northern Territory.
They're the people most vulnerable to disease, already faced with chronic health conditions, overcrowded housing and a lack of resources. Aboriginal organisations say a coronavirus outbreak in remote communities would be disastrous.
This virus could easily, render communities in a state of paralysis should it ever become an issue.
The Northern Territory Health Department is working with Aboriginal organisations on a plan in case there is an outbreak. But there are a number of challenges if that happens, including a lack of staff to service the health clinics and questions around how to isolate people. Organisations like MeWatch and the land councils are asking staff and translators to inform communities about hygiene and COVID-19 testing.
We haven't agreed on all of this at this point in time, but that's planned to be done by tomorrow.
With the peak tourist season coming up, Mr Mulholland says there could be changes to the annual Garma Festival and other cultural tours. And the Northern Land Council will this week decide whether to restrict visitors travelling to communities.
The land councils can restrict that movement of visitors going into communities. As I said, that's a last resort and we don't want to do that.
The Northern Land Council says it's particularly concerned about Maningrida after 2 fishermen were evacuated when the health department confirmed they were sitting next to a man with coronavirus on a plane from Sydney to Darwin last week. The council fears there was contact with the local community, but the NT Health Department says there is no risk to the community.
There was contact with, some tour guides. Those people need to be, should those 2 men show signs of becoming positive, there needs to be broader testing in the community.
She says Maningrida elders are disappointed with the lack of communication from the health department.
The department's got to get better messaging on the ground in communities, and I think if that doesn't change, you're going to see a lot of panic.
Tomorrow, a clinic for people with coronavirus symptoms is opening at the Royal Darwin Hospital, and the government is expected to answer some of those questions. Suwaiba Hanifi, ABC News.